Hi everyone, this is Divya from Quickmommyhacks, and today I wanted to discuss about the common pediatric skin conditions that all new parents should know about. And for this, I have Dr. Rakesh Bharti with us today. So, Dr. Rakesh Bharti is a consultant at Bharti Derma Care Center in India, and he has over 30 years of experience. He is also a designated HIV specialist by American Academy of HIV medicine. He has over 30 publications in national and international journals, and he has also authored two books, contributed to six chapters in various books, including textbooks. Hi, Dr. Bharti. So I would actually just want to start by asking you about few of the skin problems that could happen in newborns and infants, and one of them which worries a lot of parents is baby acne. So what do you have to say about that?
Starts in maybe it can occur right at the time of birth. I mean, within few days, and can occur at around 2 weeks, can last for some years even. But there is nothing much to worry. And like in adult acne, the babies also can have whiteheads, blackheads. I'm telling a common term rather than using the scientific term. So, and they may look like pustules also. Uh, and definitely, yes, the parents can be worried, but and where they occur, they most commonly occur on the cheeks,
Mhm,
but otherwise they can occur on the forehead also.
mhm.
And what happens is because of the maternal hormones, the acne can occur. There's absolutely nothing to worry. Treatment, we as dermatologists hardly ever prescribe a treatment. We just say just wait and watch. If somebody is very, very worried, then we can give some moisturizers. Eczema is of various types. One is endogenous, one is exogenous. Now, as the name suggests, endogenous means something from within,
Mhm,
and exogenous is something from outside because the newborn parents will apply so many things on the face and sometimes reading books or layman things, so they can cause eczemas, various things
mhm,
you apply. So these are called exogenous eczemas. Sometimes they can also lead on to contact dermatitis, matlab, meaning thereby that allergy to something which is applied on the skin.
okay.
But besides that, there are endogenous eczemas. Now, what are endogenous eczemas? One is seborrheic eczema, like our sweat glands. They have some secretions. As you know, there are they wear cradle cap on
Yeah.
the child's cap. Hai na?
Mhm,
So similar things because of the sweat gland blockade, similar things can occur. And this is what we call as a seborrheic dermatitis or
mhm,
seborrheic eczema. Then
mhm,
there is the atopic eczema. Now, people are mostly concerned about atopic eczema.
mhm,
What is atopy? Atopy is basically a gene you inherit which make you prone to various allergies. Now, these allergies can be on the skin and these allergies can be in the respiratory tract. But coming to atopic dermatitis, seborrheic dermatitis, I told you, there is a cradle cap and there are crusts and people are worried. They apply oil, they try to remove that with a comb or something or a brush,
mhm.
which should never be done. It should never be done.
Okay.
And the child is restless because child cannot say that I am feeling itchy. It becomes restless.
Mhm,
And sometimes this seborrheic dermatitis can occur because of zinc deficiency in mother's milk. So many a times doctor may ask you to get a serum zinc estimation done and then treat in the mother and in the child. Atopic dermatitis, the common sites are the folds like cubital fossa, these folds on the
mhm,
cheeks, behind the knees in the popliteal fossa. These are the common sites and it is a very itchy condition. A child is brought to a doctor by the parents with red cheeks which are dry, scaly, and atopic dermatitis sometimes take years to go.
mhm,
I usually tell people by the age of 10 to 12, the atopic will go. But till then, what is to be done is very simple. I usually say avoid flowers, fragrances, flavors.
mhm,
Three F's: flowers, fragrances, and flavors. Avoid pets and carpets can have mites which can cause allergy. So pets and carpets, flowers, fragrances, flavors, and then nuts,
mhm,
especially peanuts. Now,
Mhm.
many things containing peanut can cause allergy.
Mhm.
Now, besides that, there is egg and fish, which can cause allergy. These are the common sources. Try to provide a dust-free environment to the child.
Mhm.
If possible, you can use an air purifier.
Mhm.
Do away with the carpets.
Mhm.
Do away with the pets, because pets can also lead on to, of course, I am an animal lover, but if the child is suffering, then you have to do that. So use of air purifier, removing carpets, pets, and not to give egg and fish and nuts, and
Mhm.
avoiding fragrances for yourself also
Mhm.
can prevent the child from getting these allergies from time to time.
Okay.
Now they are seasonal also. The atopic dermatitis or eczema is also helped by keeping the body wet. We call it a wet dressing. The
Mhm.
child can take a bath with clothes on. This
Okay.
helps, but
Mhm.
it should not be a very long shower and
Mhm.
very hot or very cold shower. This is important. And the other thing is, most of the times we do not give anything except moisturizers.
Mhm.
But sometimes, if the condition, the child is very itchy, is irritable, is not taking food, then a
Mhm.
mild steroid like hydrocortisone tube can be given. And for control of the itch, some antihistaminics can be given. And the problem with the atopic eczema is the skin becomes dry. So
Mhm.
it has to be kept moist. How to do it? The commonest mistake is that people apply a moisturizer or emollient after bath and after drying the body.
Mhm.
The best thing is to apply the moisturizer on the wet body. If you
Okay.
apply the moisturizer on the wet body, it remains there for a long time. Skin
Mhm.
doesn't become dry and
Mhm.
child becomes comfortable. And there is another thing is nummular eczema.
Mhm.
Nummular eczema is usually a coin-shaped lesion you see on the skin. It looks like as if it is a fungal infection, but it's not,
Mhm.
because there is scaling from that and the ring is not the way the ringworm presents. And nummular eczema can usually be treated very easily by applying simple some steroid and all. And
Mhm.
then there is Pompholics. Now, this is something special. This is again, I'm talking about the endogenous eczemas. Pompholics is on the palms.
Mhm.
You see sago grain type eruptions. This usually occurs because of intake of something.
Mhm.
If child is taking some medicine, many people give gripe water or homeopathic medicine, they can lead on to this. Even some metals can cause this type of allergy. In those patients, we may sometimes have to use a mild steroids orally. First thing to understand is the erythema toxicum is not very rare as people think.
Mhm.
One. Second, it will not occur in preterm babies. It will occur only in full term babies. So erythema toxicum usually occurs in first 4 days of the life,
Mhm.
can recur up to 6 weeks. Usually you don't have to do anything. You can apply simple emollients or calamine or things like that, and it goes on its own. It's a
Mhm.
benign condition. The Mongolian spots, number one, can again start at birth or
Mhm.
can appear a little later also. This
Mhm.
is one.
Mhm.
Uh, can go up to 4 years of age. It
Mhm.
may take that much of time. The most common site is the sacral region on the back, lower back,
Mhm.
right? And they look like bluish patches many a times. And usually they say nothing. By
Mhm.
the age of 4, they go themselves, nothing should be done. But if some parents are very worried, then some dermatologists nowadays do a IPL or a Q switch laser for them. So it's very common. There's nothing to worry about it. And I mean, if you are very worried, then you can go for a laser. But as if you ask my personal opinion, I have never asked any parent to go for it. If you try to understand, it is an infection. Wherever the word itis is used, it means there is an infection.
Mhm.
And follicle means the hair follicle infection. Now, when it occurs only when a baby is given a massage
Okay.
with the oil. And the hair have a direction. If the
Mhm.
massage is done like this, the hair follicles get infected. And
Mhm.
this is what is called a folliculitis. And follicular infection usually cannot occur on its own.
Mhm.
It is parent introduced or nanny or whosoever is doing a massage, thick massage, it causes folliculitis.
Okay.
Of course, the infection is because of the resident bacteria in the skin, which becomes pathogenic at that time.
Yeah.
And it can be treated simply by local antibiotics and guiding the parents. And
Mm-hmm.
if you want to do, if you must apply oil, then apply
Mm-hmm.
in the direction of the hair.
Okay.
Then
Mm-hmm.
folliculitis will not happen. Folliculitis is not restricted to the child or neonates. It can occur at any age, and the cause is usually the massage. Milia is just nothing. It can occur at any age. Number one, it is again a blockade of the duct, the sweat duct. Nothing is to be done. It goes on its own. No medication is required. No visit to the doctor is required. Nothing. How it looks like? It looks like small little whitish bumps
Mm-hmm.
on the skin. Usually in immunocompromised children. Now, immunocompromised, those who are born to HIV positive mothers or those who have some other immunocompromisation, some tumors or anything, or if the mother who is breastfeeding the child is having an infection on the breast and areola and nipple area,
Mm-hmm.
then the child can have thrush.
Mm-hmm.
Now, thrush, I cannot say you can brush it aside and not to worry. Of course, it has to be treated. And how it is to be treated, we usually give a local application of some drug. And then we have to find out the cause. For that, we must rule out that if the blood counts are normal, it looks like as if, there is a milk layer or a curd layer inside the mouth. It looks whitish thing on the tongue, on the inside of the mucous membrane, the oral mucosa. That's how it looks.
Okay.
And if it is serious, then it becomes painful and child will stop sucking.
Mm-hmm. Mm-hmm.
That's the problem. Usually, diaper rash is troublesome when the child remains wet for a long time, when you forget to change the diapers. And so the first thing is I always tell is if a child comes with a diaper rash, do away with the diaper for some time
Mm-hmm.
and let the area remain open so that it dries completely. Of course, it can be treated easily, but prevention is more important in diaper rash.
Mm-hmm.
Now, what
Mm-hmm.
prevention? Prevention, if the area will remain wet, there will be a problem. It is again a fungal infection type of a thing which can occur. And child really becomes very, very uneasy with this type of event. First and foremost thing is to do away with the diapers for a few days, let the area remain open so that
Mm-hmm.
it dries quickly. And then there are creams available which contains zinc, parathymine, and calamine, and all other things. So they can work. But prevention, prevention, and prevention. Yes, fever and rash can be a problematic thing. And in that case, one has to go to a doctor. Roseola is usually caused by a virus, HHV6. It is of two types, A and B.
Mm-hmm.
And since it is a viral condition, uh, sometimes there is fever.
Mm-hmm.
At times there can be seizures. Child may have convulsions. And usually 10 to 45% cases of fever can have seizures and HHV1. In this roseola, there is skin rash after the fever.
Mm-hmm.
First, the fever occurs, and then there is a rash.
Mm-hmm.
There can be seizures.
Yeah.
And the other thing is, there can be spots in the oral cavity. Of
Mm-hmm.
course, it is a viral condition, and most of the viruses are, self limiting.
Mm-hmm.
So, there's nothing much to worry around. Now, most of the people think that it will occur only in hot days, summer days.
Mm-hmm.
It's not true. I have seen prickly heat in winters these days. Why? Because what happens is when a child is born, then you wrap the child so much with
Yeah.
the clothes, you think that he will feel cold, he or she will feel
Mm-hmm.
cold. So you wrap so much so that what happens next is the child sweats inside. Clothing of the child can also lead on to this. And if you warm the room too much, then also it can occur. Again, this condition has something to do with the environmental temperature because a child's skin is not that much developed that it can, cope up with that changes in the temperature.
Mhm.
So you have to protect from the extreme of heat.
Mhm.
If you do that, then a simple thing like a calamine lotion or absorb powder is a clotrimazole powder that can help it. And many times in a slightly old children, like 5 6 years of age, if there is heat and then the child gets it, then role of vitamin C is also there.
Okay.
Children are given vitamin C. In small little children, do take care of how much. I usually tell my patients that child feels as much heat or cold as you yourself are feeling. So
Mhm.
don't overdo the things. And prickly heat is like, small little bumps which are very scratchy. At times, if they become infected, then antibiotics may be required,
Mhm.
and they can occur at any age. The best hygroscopic agent is glycerin.
Mhm.
If you find glycerin and mix one part of glycerin in 3 parts of water and apply every night, and in the morning give a bath to the child, the skin will remain soft and supple. This is
Mhm.
the best humidifying agent. But
Mhm.
otherwise, what can you do for the dry skin is apply any good moisture. Even a mineral oil can do.
Mhm.
If you have coconut oil or a olive oil or mustard oil, whatever, after bath on wet body, apply that. This is number one. Number two, for the dry skin, what is more important is I always say the skin can be hydrated not from outside. It has to be hydrated from within. So
Mhm.
the fluid intake should be good.
Mhm.
Fruits should be given more, especially the berries and all. So
Mhm.
if those things are taken care of, then the dry skin will be under control. And if you don't control dry skin, there will be itching. If the
Mhm.
child itches, then there can be infection because the nails can carry the infection, right?
Mhm.
And then it becomes a vicious circle.
Yeah.
The child may require antibiotics, antihistaminics, drugs have their side effects. So
Mhm.
it is better that we take care of this, that dry skin should not occur. For that, more fluids, apply a moisturizer on the wet body, and lot of fruits.
Mhm.
That's all. So contact dermatitis, as the name suggests, is because of contact of something,
Mhm.
right? So if the child comes in contact, nowadays in COVID era, what I am seeing is a lot of contact dermatitis in small children, because we have been emphasizing too much on use of the hand sanitizers. I have
Yeah.
so many children now who've been obsessed with cleaning their hands because their parents are telling, be scared of COVID. So they're obsessed and they're using a sanitizer with more than 70% alcohol in them, and the result is contact dermatitis.
Okay.
So, contact dermatitis, as the name suggests, any contact with any chemical. This is one. The other thing contact dermatitis can occur is if the child is playing in, say, place where there is a cement, where there is dust, then of course he can develop. Or if he goes to a garden
Mhm.
and comes in touch with certain plants which he's not he's sensitive to, can develop allergies.
Mhm.
So contact dermatitis, basically remember one thing, it will not be a generalized thing. Usually it will be occurring at the site of the contact mainly, and you have to find contactant, what is causing it. And
Yeah.
once you know, the treatment is easy. You remove the cause and the patient is okay. It looks like there can be small little vesicles, and it is reddish and it is itchy usually. It can even ooze fluids if it is not treated in time, if it becomes infected. Molluscum contagiosum, if you ask me, it is a viral condition.
Mhm.
It is like a white dimpled thing on the body. Usually anywhere it can occur, but in children, even on the eyelids, it can occur.
Mhm.
Whatever age it can occur, there is nothing. If some child comes in contact with any person who has a viral infection, can pass on to it, or comes in contact with a child who has it, can get it. The
Mhm.
typical thing is it has a dome shaped thing,
Mhm.
right? And if you pierce one, a Kurdish material comes out of it. This is how it looks, molluscum contagiosum.
Mhm.
It is a viral condition. It is again self-limiting, and if you don't do anything for it,
Mm-hmm.
Then also by around 2 years, it can go. As a matter of fact, if you ask me, the British dermatologists suggest that don't do anything.
Mm-hmm.
But then the parents are worried because they start increasing. If there is one hair and the child scratches the second, third, fourth, so
Mm-hmm.
the parents get worried that what is this happening? And once you say it is a viral condition, they are more worried. So what can be done is they can be froze, and they can be freeze
Mm-hmm.
with cryo. This is a modality which is very simple. Um, in few seconds, each one can be destroyed. Then
Mm-hmm.
there are certain chemicals which are available over the counter also, like cantharidin or sometimes KOH, is potassium hydroxide.
Yeah.
But how to apply it, a dermatologist can always tell you. So the best thing is, do not worry if they are increasing, then because if the child scratches, they can become infected again and there can become eczema around that.
So, in general, like from your point of view, as general practices, what would you suggest new parents, to do so that, they can take care of baby skin?
Common sense, number one. Do not panic, because I know these are the days when people have one child or two children. So do not panic. Use your common sense. Think yourself that why something has occurred. If you cannot make out, then see a doctor and take care that the child, as long as you can breastfeed the child, the better it is, because you pass on very good immune material to the child, which keeps the child healthy. So
Mhm.
breastfeeding the child, and once you feed, then take care of the diet. Do bother about the milestones in consultation with the pediatrician. Do not forget the vaccines in time. These are important things. And start, don't think that a child doesn't like this or doesn't like this. If you don't like, child can eat anything because he has to develop taste.
Mhm.
So breastfeeding and taking good care of the skin is like, do not use harsh chemicals, do not use fancy soaps, do not use so many chemicals for yourself also when the child is around, especially the fragrances, I said, the perfumes, and these things should be avoided. So if you are smoking, the child is getting the passive smoke and can become ill,
Mhm.
unhealthy. Right?
Mhm.
Keep the atmosphere clean as much as possible. Now there are ways you can use an air purifier
Yeah.
so that child doesn't develop allergies.
Mhm.
Avoid giving food materials which have artificial flavors and colors.
Mhm.
No, don't give candies with artificial colors because they can cause allergies.
Mhm.
These are the common things. Use common sense.
So, thank you so much for being here and for answering all our questions. This was really helpful. Thank you.
Thank you so much. Pleasure talking to you.
Well, this brings me to the end of this video. Thank you for watching. If you like the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram for some personal tips on pregnancy, childbirth, and motherhood.